Hello everyone, I am Dr. Vijay Sinha, Director in the Department of Nephrology and Kidney Transplant at JP Hospital, Noida. Today I am going to discuss about nephrotic syndrome in young children. This is a very common disease seen in children between the age of 2 years to 9 years, sometimes up to the age of 15 to 18 years. The children present with facial swelling in the legs, abdominal swelling, shortness of breath, presence of froth in the urine or sometimes blood in the urine, and when we examine them they have got high blood pressure in most of the patients. So these kind of children, they either present to the pediatrician, to the physician or to the nephrologist. The treatment is very simple. Most of the children respond to a treatment called as prednisolone, which is given as per the height and body weight of the patient. The treatment is given over a period of 12 weeks and sometimes more depending on the response. Most of the children respond to this medicine very nicely, with urinary protein going down from 4 plus to 3 plus to 2 plus 1 plus over a period of around 4 to 6 weeks, and after that the child is giving another 6 weeks of treatment once the patient has got trace or 1 plus protein in the urine. Sometimes the children also have blood in the urine, but they may be a part of nephrotic syndrome in few of the small children. Sometimes the children have got recurrence, and that recurrence may happen once, twice or thrice in a year, or sometimes on the withdrawal of the drug. So whenever these children are having recurrence, if they are having recurrence more than 3 times in a year, they are called as frequently relapsing. The treatment will change and go to the next level if they have a frequently relapsing disease, and the drug which are commonly used is either cyclophosphamide, levamisole, tacrolimus or cyclosporine. They are given adequately over a period of around 6 months to 1 year or sometimes even more, depending on the which treatment is being used and how is the response. The children who are having infrequent relapse, that means less than 3 times in a year, are given short courses of prednisolone again for the relapses. Sometimes these children are having steroid resistant disease, that means they are not responding to the prednisolone and they may be given alternative therapies as I discussed before. Most of the time the treatment is successful, response is good, and children goes into complete remission or sometimes cure after a period of certain months. Parents usually have a lot of anxiety whenever the children has got a disease of nephrotic syndrome or they have relapses. But I would request the parents to keep patience, bear with your treating physician or the nephrologist, and follow the precautions and the treatment given by them. Most of these children will not have a kidney failure later in their life. Their kidneys will remain preserved and will function normally. A very small number of children may have some other disease which usually present as either steroid resistant disease or frequently relapsing disease, where the physician or the nephrologist may advise you to go for a kidney biopsy. Kidney biopsy is a very minimally invasive procedure with very less frequent side effects and is a safe procedure. So whenever your doctor suggests that you go for a kidney biopsy, in my opinion, one should follow the doctor's advice and go for a kidney biopsy as early as possible, so that a particular diagnosis can be obtained and the treatment given as per the pathological diagnosis. The children usually have got a normal lifespan, normal kidney function once they have been completely treated. A very small number of patients will have a problematic disease where the disease may not respond to first or the second line of treatment, and such children may require to undergo third or fourth line of treatment depending on the kind of problem they are having. But in my own practice and overall worldwide, the data suggests that most of the children will respond to the treatment, and the parents should be counseled at every visit because they are going to have a lot of anxiety because of their children's problem. So overall, nephrotic syndrome is not a dangerous disease. Most of the children will respond to the treatment and will have a complete cure. So have faith in your treating physician, have faith in your doctor, have faith and patience with yourself and your child, and your child is going to have a normal, healthy life. Thank you so much.